So welcome to another episode of Discover SRQ video podcast. My name is Marius Mocan, a realtor here in the Sarasota, Florida area. Today, we have Dr. Caroline Peterson in the studio. She is a chiropractic physician here in Sarasota. And tell us a little bit about your journey and how you got to where you are today.
Well, thanks so much for having me here. Sure. Well, I was born into a chiropractic naturopathic family in Eastern Oregon. And when I first became a chiropractor, I went into practice with my dad and my brother. And my interest was always in maternal child health. And so I practiced there for a little bit. Then I went to grad school out here at USF in Tampa to get my PhD in applied anthropology and epidemiology, because I really wanted to do research. I wanted to do clinical practice and a combination of research and natural medicine. So eventually, I became a midwife, and because I loved that maternal child health, I wanted to do fertility or preconception through 6 months of the baby. So that whole time period, pregnancy, postpartum, all that stuff. And then I went on to be, after I got my PhD, NIH, National Institutes of Health postdoctoral research fellow at Oregon Health Science University. So that took me back to Oregon, where I was in neurology and OB-GYN, urogynecology, studying pregnancy-related low back pain. And then I started a clinical practice at that time and just kept rolling with it. And as my patients aged, then I was like, oh, I guess there's something that exists after 6 months of having a baby.
Gotcha.
So I had to keep expanding my practice as people aged and they had different problems, but I always stayed pretty focused on women's health. And now in Sarasota, I don't do much pediatrics anymore. And it's really focused on women's health from, reproductive issues, whether it's, problems with their period, problems getting pregnant, problems staying pregnant, or the pregnancy itself and the postpartum, and then afterwards, the things that happen with prolapse and incontinence and stuff like that. And a big interest of mine is chronic pain that doesn't resolve with kind of like the standard intervention that you would expect.
Such as adjustments and chiropractic treatments, things of that nature.
Sure, that's right. So like standard adjustments, massage, acupuncture, PT, stuff like that. Anything that people would kind of think about as go-tos for chronic musculoskeletal pain.
Exactly. And on your website, it says that you look at the body as a complex organism. How does that translate to how you approach care for your patients?
Right. So over the years, I began to appreciate the complexity of the body, which is the same as the complexity of the person, right? That we're not just a musculoskeletal body. We're made, there's a lot of different aspects. There's a lot of different lenses that we can use to understand who we are and what we're made of and how to feel our best. And so when I think of the body, I'm thinking really of 7 different bodies. This is the way that I kind of organize it in my mind and try to help my patients understand it. So most people think of, the musculoskeletal body. That's the muscles and the joints. I have neck pain. I have back pain, and they think, there's something wrong with my muscle. There's something wrong with my joint. There's, stuff like that. So the way that I see chronic pain, a lot of times it hasn't resolved with these types of standard interventions, is that the musculoskeletal system is the voice of the body. It's saying something's wrong. You're not quite hitting the target here. If you have to keep going back for the same intervention, it's palliative care, right? It's not resolving the issue. So then I started thinking, well, what else is there? And so what we have is we have a fluid body that's very closely related to the musculoskeletal body as far as where it lies in the body. And so if our fluid body, which is the blood body, the lymphatic body, the cerebrospinal fluid, the lymphatics, if that fluid in our body is not moving properly, then it will be expressed through the musculoskeletal system in certain particular ways. Then we have the organ body or the visceral body. All of those things, everything has to move in our body. When things aren't moving properly, then there'll be stagnation. And so usually the organ body will speak through the fluid body, and that will speak through the musculoskeletal body. So there's this layering effect that's going on. We also have the air body, right? That's our breathing. And so the breathing body, the whole breathing apparatus, is supposed to set our drainage system for the fluid body. It's supposed to set our autonomics. That's how relaxed we feel, how well we're able to cope with life, our level of anxiety, right? Through the sympathetic, parasympathetic nervous system balance. All of that is set through the air body and doing that properly. And so if that's not right, again, we'll have these layered effects of things like not coming together to work properly. We have the emotional body, right? Our feeling body. A lot of times if we have had trauma, feelings will get stuck inside of us. And then we can actually use the musculoskeletal body, the physical body, to help express those feelings. And then all of this is like held within the energy body. The energy body is what everything, it's like the infrastructure for the physical body. Everything's built off of that. So all of these different bodies have to be functioning well in order for us to feel good. And so when I work with these bodies, I'm really, in my mind, I'm working around 5 transverse planes. And these transverse planes are really interesting because they correspond to the way the energy body is divided, the way the fluid body is divided, and the way that the musculoskeletal body is divided. So we have a transverse plane here, here, here. Everybody knows about the respiratory diaphragm, and then the pelvic floor. Every woman at least knows about the pelvic floor.
Right. Now, is that kind of why they roll around in a yoga ball when they're pregnant, kind of take some tension off, some relief? Because I've noticed my wife doing that during her pregnancy quite a bit, and especially when she was kind of going into labor.
Oh, well, it's also called a birthing ball.
Sorry.
and so it's very commonly used in labor. Mm-hmm. And it's nice because it offers some support. It offers the ability to move. And so you can kind of get your body into a position that's comfortable and help the baby move down. Other times it's used for other things. So like a lot of times I'll recommend that people not sit in chairs like these. These are not awesome chairs to sit in because
Thank you for that.
Sorry. Is that mean? So it would be,
I understand what you mean.
It would be like way better to be sitting on a gym ball, right? Because this is like you're collapsing on your body in this chair. Okay. A gym ball forces you to sit into a neutral position where you're able to
support yourself,
to rise up and out of your body. And this is kind of like reversing all the curves. And so, but I'm nothing personal about these chairs. These are just like the standard chairs that people use, which are not ideal for our body. I'm very embarrassed to say that physical anthropologists created the airplane seats as we know them, which are terrible. They're all about reversing the curves in our body. And so basically I'm saying the design of our lived environment is not ideal for our body. And so we need to do some workarounds, or at least bring some attention to that as we move through our lives.
You talk about pelvic pain a lot. So what are some techniques that you might use to get rid of that chronic pain that people are experiencing in their pelvic area, lower back area, hips?
Sure. So anybody that I see, I'm not the first person they see. And so they've already done a bunch of stuff. And because our healthcare system is designed in silos, then there's a bunch of different specialties that have chopped up the body into regions, right? And so anatomical regions or physiologic, processes. And so this actually is not a super awesome way to work with the body because it turns out everything's connected. And so if people have chronic pelvic pain, they've usually gone to a bunch of people who have focused on their pelvis and tried to help them get better. And they probably have felt better for short periods of time and then the pain comes back. So usually what that's telling you is that something's going up on usually higher up, because everything drains up. Everything drains right here. And so when I'm saying everything, what I mean is the blood and the lymph. Of course, that's not everything, but the cerebral spinal fluid goes up and down. Lymphatics are just in the head. But basically, everything comes up here. And so when I'm looking at people, what I generally see are a lot of vascular issues, because most people have not dealt at all with the vascular system. And many times there's a visceral component to that, which is very uncommon to have, met people who work with the visceral system. Most patients haven't had a lot of visceral care. And so we have to make sure, what I start with is up here, make sure everything's draining, work down, make sure everything's open and coming up. These transverse planes, the respiratory diaphragm has to be stabilized and supported by the kidneys, by the liver, the organs, right? And in order to get drainage coming up. And so if those things are not in place, then what's happening is that we're having like a falling down into the pelvis, so that you can't really get any improvement in the pelvis unless you work with things higher up. A lot of times people will say, we're hung from our ears, right? Which means that this is really where things start. So I listen to the body with my hands. They say, listen, how can you listen with your hands, right? And so, but we listen means perceive, right? And so it's a way of perceiving with your hands to see where the body guides you to where the problems are. So that's how I do it when I'm doing manual therapy. And so eventually you want to get down into the pelvis itself so that you can work with, the uterus, the bladder, the ovaries, the sigmoid, the cecum, parts of the intestine, rectum, and so forth, so that it has to be a whole body approach that is inclusive.
I see. Okay. That makes a lot of sense, how we're all connected. We shouldn't be taking each part of the body, giving it a different department. You see this doctor for the feet, this one for the headaches, this one for the XYZ, right?
Well, the thing is that it works a lot of the time. That's why it's set up like that, right?
Gotcha.
So it works. If your problem is actually like this tooth that needs to be filled, awesome, right? That's super. If you actually have a, torn meniscus that needs surgery, well, you need to see a specialist who does that day in, day out. That's awesome. What I'm talking about really is the people who fall through the cracks, right? And so that's who I'm about.
You're very niche. I like that. I like that.
And so the other thing is that it's not always a physical. The research is consistent that women are about 1/3 responsible for all difficulties getting pregnant. The men are about 1/3 responsible, and then the couple and their kind of special interface with each other is about 1/3 responsible. And so basically you can say it's half and half. Although men are very reluctant to get care. And so generally what you see in the whole entire healthcare system is that women are the ones who get most of the care and do most of the intervention. And then they can't get their partner to come in. So I'll be like, hey, this is how, if you want to get things checked out, this is how you do it. All you have to do is just, give a little bit of sperm and have that evaluated. Super easy. Takes like $100 to do it. So it's very inexpensive. And then there's a bunch of stuff, just nutritional stuff they can do. And then little lifestyle things like, hey, wear boxer shorts, or don't put your computer on your lap, or, stuff like that. And, but most guys will not come in to get checked out. And so sometimes their partner can give them these hints, and sometimes they'll do it, sometimes they won't. But that's just, notice what this is called, Natural Women's Health Institute. Why? Because almost everybody who goes to the doctor is a woman. Men don't go.
That's true.
They don't go unless it gets real bad. And then maybe they'll go. That's just the way they are. And so that's all right. That's why I decided to target women, because they're more likely to go to the doctor.
Right. Exactly.
Any man I see is like under 5 or drugged there by his partner.
Like me, I go for a checkup every maybe 5 years or
There
so.
you go.
Right.
It's just the way things are. That's all right. I
Yeah.
don't hold it against you.
Yeah.
Now, it's okay. If a guy wants to come in, sometimes women will say, well, do you treat men? I'll say, yeah, sure. Yeah. And so men have all the same stuff women have, but they have to want to get it taken care of. If they have pelvic pain and they want to get it taken care of, awesome. If they have chronic neck pain, they want to get awesome. If they have, diabetes, if they have whatever it is they have, no problem. Glad to help you. Men have pelvic floor issues, right? And so no problem. I can help you with that. Whatever they've got, it's fine. I'm glad to show up and help for that. It's just that they don't want to
Yeah. Exactly.
until it gets bad enough. And that's what my dad always used to say when, in rural Oregon, right? There, I came from a little ranching town, right?
Mhm.
So, and natural medicine, was something real far out there. And so my dad a lot of times would say, if a patient didn't come back, my dad would say, well, they're not bad enough. They'll come back when they're bad enough, right? Because they've gone through all their other options and they'll come back. And so that's what I think all the time too, that I'm there to catch you when you're ready, right? So if it's not, preconception, getting things set up, awesome. Then, when I had more of pediatric practice, helping through the pregnancy, postpartum, helping the baby with their latch, awesome. If you bring your baby in, if you don't, we'll catch it later, right? Then when the baby starts developing and doesn't go through their milestones appropriate, awesome, I'll catch you there. If you come in, if you don't, we'll catch it later. And so that's basically my perspective, that I'm here to help when you're ready. When the time's right for you, when you get bad enough, come on in.
Well, thank you so much for being so open with us with your practice and everything. She is so willing to help out